What the ACE study did is it sought to take a look at how childhood experiences influence neurodevelopment, the adoption of health risk behaviors and risk factors for preventable diseases. We looked at 10 categories of adverse childhood experience. We looked at abuse, physical, emotional, and sexual abuse, childhood neglect, that included physical and emotional neglect, and what we called household dysfunction, which was growing up in households where there's mentally ill caregivers or mentally ill people in the home, household substance abuse, domestic violence, parental separation or divorce, or criminal behavior in the house. So those are the 10 categories of experiences that we called adversity. And what we found when we studied them is that they're really common. And the second thing we found is that when there's one of those types of experiences in the life of a child, that there tends to be multiple others. So they're common, they're highly interrelated, they co-occur. And the third thing that we found is if you add up the number of categories of experience, that there is this cumulative impact of those experiences on the risk of public health problems. Many of the leading causes of death in the United States are somehow associated with ACEs, things like stroke, diabetes, risk factors for HIV/AIDS, cancers, and the behaviors that lead to those. We found that people who have high levels of adversity in their lives tend to die younger, so it causes premature mortality. And in terms of morbidity, probably the greatest impact on morbidity is in the area of substance abuse and mental health. I think it's very safe to say that ACEs are a leading cause of both mental health and substance abuse. And everywhere this has been studied, there's this very powerful relationship between childhood adversity, mental health problems of various sorts, and substance abuse problems of various sorts. At this point in time, the way states can use the ACEs surveillance data, I think, is to point out that these problems, the mental health and substance abuse problems that are so prevalent, are largely preventable, that they're not necessarily destiny or genetics, they have genetic components, that many of those problems are very experientially oriented, that the traumatic stress of abuse and neglect and other ACEs affect neurodevelopment in a way that leads to mental health and substance abuse problems. So I think the major thing is to say that much of what happens in mental health and substance abuse can be prevented if we can reduce the level of stress in children's lives.